an honor to speak with you today. Let's begin with trust, which is central to our topic. In your journey building donations, what were the biggest trust-related challenges you faced, either with institutions, communities, or youth, and how did you respond to them?
So my donations was founded at the age of 18. So I started when I was 18-year-old after the explosion of Beirut. So the first insight of the people, are you for real? Like, you're not joking, you're not playing, it's not a game, it's a non-profit, you're tackling patients' lives, it's health, and it's not just, you're cooking meals and you're distributing food boxes or you're doing some field work. So for me, perceiving this was disappointing, and I had this passion driven inside me, like, I want to do the change, I want to make the change happen no matter what. And just receiving negative thoughts from the patients, from the people, from government institutions, NGOs, leaders, international individuals working in international governments, international nonprofits, and also policymakers that we met along the journey were saying the same. That even if you start now and if you succeed with the mission, you're gonna fail. And after the first year, second year, third year, and now fifth year, we made it, but it wasn't an easy journey at all. We gained trust through several platforms. First, transparency, like being fully transparent by every single step. Like if anyone gave us one box of medication, we traced this box of medication. I wanted to be fully transparent and confidential, and make sure that every single donation is being sent to the individual. Example, if you donated one box of medication, you'll know when this box was picked up, how this box will be placed, stored, and to whom this box will be given. Like, you'll know the entire process, as if you are the individual who took the box of medication and give it back to the patient. So having decided on this process, I have built trust after a few years, I would say, after the first year. So it allowed us on the second year of my donations in 2021 to be able to go internationally that fast. So we scaled the nonprofit in a very fast way to have it in the second year of its existence be present in more than 36 countries. Just voluntarily, by having individuals running the nonprofit. So individuals are the ones who gain trust with us before institutions. So the first approach with donors was, if you are an individual living in the States, let's say, and you have medication, give us your medications. Or if you're an individual living in France and you have $100 or 100 euros you want to donate, go and buy medication X, Y, and Z. So the core of my donations is individual-led actions and youth-led initiatives being made in Lebanon and abroad.
Based on that experience, how do you see the role of young leaders in shaping global health and humanitarian diplomacy today?
Their role is vital, but it's not about their role, it's about how much they're allowed to, and how much they believe in themselves, and how much they allow themselves to be part of it. And here, I used to really love a sentence which is inviting youth to raise their voice. But after a few years in working in the field and working in this industry, I would say I don't like it anymore, because I want to invite youth to start acting and not just raise their voice, because it's a big difference between you just raising your voice and trying to shape policies or structure plans or write business plans, ideas, and so on. But if you don't take this voice, this idea, this plan into concrete action, you're not doing anything. And I don't see any role in just forming this without having its action backed up with actions. So for youth, it's all on us. If we're expecting change, we cannot expect change from governments or from institutions that already failed before several times. So it's on us to take the lead, it's on us to take the decision that we are the decision makers for our future. It's not someone else who will decide our future. It's not someone else to blame if something goes wrong in our country. It's for us to take a decision that I'm gonna change, even with small perception and small detail. Like, I took a decision when I started my donations to change, and I'm changing maybe 0.1% of the healthcare industry in Lebanon, or healthcare management, or non-profit, or healthcare assistance, all in all. But I'm changing. I'm not only blaming individuals. I cannot blame someone from not doing the thing right if I wasn't doing the right thing before, or wasn't trying to do the right thing before. And we hold a very special power as youth, because we have the energy, we have the tools, we have the means, we have the knowledge, we have everything that past generations didn't have that much. So we're privileged. Let's use this privilege that we have. Let's use the tools that we have, the resources that we have. We're fortunate to be connected with everyone that we want. We're fortunate to have a very wide knowledge, technology, and everything. So it's way much easier for us to reach the end goal that we need, and to be able to create things and to change things way much faster, way much in a more tangible way. Just have the will, determination, and back your words with actions.
If you had the chance to advise policymakers directly on how to bridge the gap between youth-led initiatives and formal institutions, what principles or values would you emphasize?
Actually, the first one is not to make a place for them on the table, but rather make a place for them in decision making, because it's different. And we go back to allowing them to take the action, and then allowing them to actually, whatever they work on policy making or policy plans, business plans, and so on, to be able to really have the means and have the right pathway, or the supportive environment for them to be able to implement it. Second, do not only take their second thought comments on something, because we see it way too much. Even if we have interns as youth, and some ministries, and some governmental draft papers, and so on, we only ask them to comment on the plan, but never to be part of the structure and part of the process. So allow them to be part of the process. Allow them to be really active members, and not just members who will maybe give some insight over it. Last one, make programs, specialized programs, train them, build awareness with them, mentor them in a way that they'll be able to be fully equipped when being alone, while being independent on the field, while being independent while building their stuff. So mentor them, build the programs who are supportive for them, give some not only membership, but give us some funding. So if they're starting a non-profit, a for-profit, whatever it is, so they'd be able to work on field without the need to go to outer governments, outer non-profits, outer individuals to support them, so they can be independent while they're serving their own country. So in whatever region, whatever country I'm talking, and not specifically in Lebanon. So it's for all youth-led around the globe. So it's the same thing. These three things are vital, important things that should be done. And because I've lived the lack of them, that's why I see and urge in making them happen. And as we sit as youth together, and everyone is starting things on their own, we wish that one day we can reach a place where youth are part of the decision making and the concrete action plan, and they're the ones who are doing the work on the field, and not the ones who are just watching people doing things on the field.
Have you had the opportunity to turn your work into international policy advocacy? If so, what was that process like, and what did you learn?
Actually, yes. We registered my donations in France in 2023. And it was the first bold step internationally after being registered in Lebanon for 3 years. And in Lebanon, we couldn't really make policy advocacy work. We're not allowed, kind of. We're just allowed to be on the humanitarian part. And we never worked with the government in Lebanon. which is also something that some people do not really understand, how we work alone as an entity. But it was really challenging. But what's important in this step is that we stepped out a bit to have a backup plan in France and an official HQ registered in Europe. But what we've done there, we took one of the problems that we're facing, not the major problems, like we have healthcare issues, healthcare assistance issue, medications, and so on. So we took one problem, which is medication supply chain and expired medications problem, and we're now working for some policy changing in Switzerland with one of the non-profits in Switzerland called Suisse to be able to gather medications before they get expired, so to legalize the process. So we're building a supply chain for medications before they get expired, like early shelf expired medications, and we distribute these medications to third world countries or countries facing war or other problems. Lebanon, Africa, Ukraine, and so on, all countries that are in need of medical support, to be able to distribute them, since this is illegal to be done, and kind of many are doing it. So why not creating a policy and a law to have it regulated, and some regulations to regulate this process, especially that Switzerland is one of the major countries having one of the hugest pharma companies around the globe and pharma hubs, and they have massive stocks that go unused every single year. And in statistics, 50% of medications globally goes to medical waste. So why allowing the 50% of these medication being manufactured to go to waste, while we can change this by doing one law or by creating one policy, starting from Switzerland, and hopefully when we get it all done in Switzerland, we'll be working on the same thing in France, and hopefully expanding to other European countries, reaching different aspects of maybe surgery coverage, treatment coverage, some organ donation programs that we're currently working on, and working on some policies regarding them, and health equity policies. So we're getting started. I would say we're not far with it, but we're getting started. It started 2 years ago, but of course we've made the huge step as a youth-led organization, doing the work alone, not having any prior experience with this, and we're only 5-year-old. So I would say that for us, this is a major step moving forward, policy making or policy advocacy, if you want to name it.
Thank you for having this interview with us.
My pleasure.